So I'm going to talk to you about gamification in medical education. This is one of the new upcoming, incoming areas in medical education, which is happening right now. So this is going to be my schema of presentation. I'm going to talk about gamification as a concept. Educational games versus gamification is where I will start with. We'll try to trace the history of gamification as it exists today. What are the learning theories or what is the basis, cognitive basis for gamification? How is it currently being used? And what are the TL evaluation activities where gamification has come into play? So that's what initially I'll talk about. I'm going to talk to you about the technology which is used for gamification. What are the tools available? And what are the critical elements these tools use? I'm going to talk about the perceived advantages and the flip side of gamification. And I'll end with capacity building for gamification and how to seize the day. So that's the schema of presentation, what I would be using. So there is a lot of difference between game-based learning and gamification. There's something called as educational games, where the entire education is in the form of a game, right? Whereas in a gamification, we use elements which make games appealing to people and then use them as part of education. So that's the difference between game-based learning and gamification. So we might be using certain things like if in the games, most of you with small children will know, they like the reward points. They like moving up one step higher challenge. So if those things are the things which are appealing to them, we could use those elements in the design of educational settings. So that is what gamification is all about. So there can be structural gamification. The entire structure of learning can be changed. I remember when my daughter went to LKG, the ABCD was taught as abracadabra. They used the phonetics rather than the traditional ABCD to teach children. So that is a entire structure which is there. Or you can actually gamify the content. Like you want to teach teamwork. You will be normally talking with PowerPoint slides or you will give them a handout about teamwork. Maybe you will give them a case or a problem. You can entirely change that into an exercise where they have to work in teams and overcome challenges. So the content or the structure can be gamified using elements which are featured in popular games. So this gamification is actually a very lucrative market. That's what I would say. And if you see the growth of this by region, if you see Latin America and Southeast Asian countries, we are somewhere here. We are one of the most lucrative markets for these educational enterprises to tap into. And a lot of companies are coming forward and trying to make educational games, trying to build in all these elements into the learning management system, trying to build this into their applications so that people are hooked onto them or they are trying to find it much more attractive. And one thing which we found about this Gen Z is their attention span. Earlier, we used to have currencies, right? Industrial age, the work was the currency. Money was there at some point of time. Then data became currency. But now data or information has become ubiquitous with just one click of your button. So it is the attention of people which is the currency. If I can hold your attention for 20 minutes, then I'm a very good speaker. If your class students can refrain from looking at their cell phones for every 1.5 minutes, then I think we are doing a very good class. So that is what we need to think about. So these elements try to grab their attention, to keep them riveted on doing their homework, doing their assignments and things like that. So we are tapping into a very lucrative potential market. So how did this gamification start? So I have a short video. It's self-explanatory. So as we saw, it started with Baden Powell when he started the Boy Scouts. We used to get that badges, right? If you help elderly, you will get a badge. If you do some sewing, you will get a badge. So reward points, badges. Then the American Airlines introduced reward points. Then the Army started using these for recruitment strategies. So are you aggressive enough to get into the army? So that is something which we did. And the last to get into this forte is the educational sector. So that's how the gamification developed as a concept over the years. So don't worry, I'm not going to bore you about all the 118 learning theories and what they say about gamification. But what we know about learning theories, and by the way, all my talks have references, all my slides have references. The QR code, which is there in the top left corner, is the reference for that particular slide or what concept I'm talking about. So if you look at the learning theories say that the games are immersive, right? Sometimes we've seen children who come for counseling by parents. He keeps playing games, doesn't eat, doesn't do anything. Sometimes they even pee in their, when they are so immersed in the games, they don't even get up to go pass urine. So that's the kind of immersive experience games provide, right? Not educational games, other games, right? Goal setting. It helps them to clear this is what is the level of difficulty you need to clear to unlock the rewards or to unlock the next level of game. It also gives a guided path. In case you're going wrong, you get some cues, right? You can also get some uh, references or cues which they give to say, okay, this is how you need to address this. It helps to set behaviors. So if you do something right, you get a reward point. You get some good stars. If you do something bad, then you go back. So when this helps to set up systems, like traditionally how reward and punishment works, that is reinforced because you are in an immersive learning environment. There is some amount of motivation. If they play games as a team, there is a social learning happening. They learn not only from the educational activity, but also from each other. And most importantly, games try to lighten the cognitive load. If they have to read so much, if they have to do, there is a pediatric sim game. All the pediatric emergency simulation scenarios are converted into simulation-based learning. So if you have to read those entire protocols and then do, it becomes much more uh, dreadful for the students. But when they are going to do it as a game or an activity and exercise, the cognitive load comes down and they perceive it as enjoyable learning experience. So that is what most of the learning theories agree, and they say that gamification is truly helpful. So who uses them? These are the specialities according to this scoping review on gamification. These are the specialities which we are using. A lot of thing goes into computer science and IT as it is expected. We are somewhere around that measly 10%, medicine, biology, psychology, that much. Better than language usage, but all other specialties are doing much better than this. And what activities for which we are using? Most of them are online class learning activities. Suppose you want to start a class, you want to do an ice breaking, you want to do a quiz in the middle of the class. So those are the kind of activities which is used. There can be some exercises, but if you see where things can work very well, the tests or assessments, we're only about 8%. Social interactions, collaborative discussions can also happen. There can be game-based exercises, which the teams, they can work as either individuals or teams and compete and complete the necessary challenges. Projects can be game-based. So these are the some of the areas in which game-based learning activity is quite used. So that is gamification as a concept. We saw how the learning theory is supported and how the history of gamification has evolved. Let's look at some of the tools which are available. This is again from this very nice scoping review which was published in Academic Medicine. So if you look at the clinical and paraclinical sciences, I want you to notice two things. One is the name of the game, and the other one is the name of the organization which has come up with this. So these are some of the things, and this scoping review is slightly outdated. It is 2020 pre-COVID review, and these are some of the things which are available. Try to find like what are all the games which are available in this. There are a lot more games which are available post COVID. Like for example, there is a cleft game. So something about how you would manage cleft lip patients. Then there is one escape, which is there for emergency medicine situations. It is come from some company in Germany. So there are a lot more games which are now available in the post-COVID, which will help students try to learn or master one simple concept. So these are very many tools which are available. So when we look at gamification, when we look at any educational innovation in for that matter, so we are going to ask these 4 questions to ourselves. What is it trying to do? Is it going to be a substitute for what I am doing? Is it going to augment or supplement what I am already doing? Is it going to is it going to modify, or am I redefining the way in which I'm looking at these things? So based on how bad or how good it is, it can be an iterative process where you can deliberate upon, or it can actually transform the way you think about or do certain things. For example, you can actually use games as a substitute for traditional methods of enhancing learning. Instead of giving assignments, no, you have submitted, you've done well, good, and all that. You can give them points. You can actually produce a leaderboard for your students, no? So in this class, in this assignment, these are all the people who have, how people have scored, and so is the leader. So if you actually do that, it gives you an option to enhance this certain critical elements. You can actually augment what they already feel. So I said we have badges or points. So if you finish one assignment on time, so you can say academic badge, you receive one badge. You accumulate certain badges, so you can get certain reward points. You can tell your students, you can cash your reward points. Suppose if you have, let's say, 10 reward points, you can miss one biochemistry lecture. Something like that, if you do, then probably you will have students coming in for it. Okay, you can also have levels of learning. So this is for initial novice level, this is for an advanced beginner, this is for a competent. So you can have different levels of learning. You can modify your games or using games to modify some of these previously what you have been doing. You can talk about user journey. So you ask them to go through certain pathways of learning. You start with initial one level, novice level, and then they go up. And as they go up to more advanced level, right, they use it in simulation very effectively. So you start with level 1, then you go to level 2, then you go to level 3. So what you do in each of the levels might be different. Initially, you might be part of the exercise. Then you might be part of the designing the scenario. Then you might be part of setting up the scenario of doing. Then you might be part of the debrief team. So you could actually talk about your experience in going through various things. So learner journey is another one. You can also use redefine the way in which you do. So for example, teamwork. We could actually do it in a much different way. Like one of the exercises which can be done very effectively is to use simulation to identify problems and to address problems. Like we did a study recently. We found that the surgery specimens which come to pathology, either they are wrongly labeled or they come in a wrong solution. It might be for a frozen section, but it would be put on formalin. Or it might be for cytology and it might be put in something else. So the specimens can be wrongly labeled. The specimens can come in wrong solutions. Sometimes the specimens can get lost also. So what we did was we did an in situ simulation. We went to the OT. We had the anesthesia team, the surgery team, the nursing team, etc. Then we actually ran a simulation scenario of how they handle the specimen. When the surgeon takes it out, who receives it, who labels it, and who sends it. So when we ran this, we could identify where all we had problems and how we can troubleshoot. So we could do that as a diagnostic exercise. We could also come up with solutions which we can do. So a few months later, when we ran the simulation scenario again in the same OT setup, we were able to see that there has been a process improvement. So you could use this as a substitute for what you normally what we'll do a quality check, we'll do an audit. But instead, you could also use them as very effective tools for diagnosis and correction. So those are some things which we would do. When we talk about critical elements in simulation, what are those? So whatever you are going to do, whatever activity you are trying to do, or whatever games you are trying to build it, what are the things that work, right? Based on this thing. So what works is traditionally whatever we say in medical education. So if you don't have your mission, if you don't have your objectives, then it is not going to work. You might make a very good game, but unless it has a basis. So you are on a mission to save this child's life who has come with severe breathlessness to casualty, then it makes much more sense. So this is about a pediatric emergency, which is involving airway. That is my learning objective. Then it works. Otherwise, just giving something which doesn't have a context does not help in learning. So the most important is your mission and objective. You have to have an engaging narrative, and that narrative should be something which is feasible, right? If I'm going to teach somebody about having patient communication skills about a newly diagnosed diabetic, so I should have a similar scenario which is commonly encountered. It's a 45-year-old man who is diagnosed based on a screening test, which is a common scenario. Suppose if I say that this is about a 28-year-old diabetic who is presented with this thing, it can be common, but it is not normally what you would teach a third-year students. So the narrative should be engaging and it has to be real, contextualized to what is a real world scenario. You have to have recognition and milestones. So how you are going to do, this is level 1 of learning, this is level 2, level 3. You need to have very clear milestones. There has to be advancement and content unblock. So if you clear this level of challenge, if you know how to manage ABC, then you would go into metabolic parameters management. Then you would go into more advanced surgical management. So if you can unlock seriously over a period of time, like as you clear one challenge, you unlock the next challenge, then it works. Otherwise, if you dump all the information in the beginning itself, then students either get confused or they get driven away. So that is a problem. So when you do this content unlock and advancement, you also need to provide instant feedback. This generation wants instantly feedback. As and when you do things, you need to do that. There has to be some element of team play and cooperation which should come in. There has to be a reward-based program. So you clear this within this time, you get so much more rewards. And there can be competitive ranking by having leaderboards in the session. So these are some of the critical elements which work in game-based. So you could build this very, very effectively into your routine teaching also. So instead of just giving them only a grade, no, you can also give them some reward points. You could make it into a friendly competition in your class, right? So these are some of the best strategies which are used. Having point systems, leaderboards, academic badges, or students feel recognized when you do that. Sometimes you can even throw in some surprises. So this team has done very well. So they can skip one and go to the next level of challenge. Things like that. You can have quizzes periodically. You can have quests which can be there. It can be like a treasure hunt or it can be a knowledge quest, any of those. Allow students to take avatars or role play. So that makes them feel much more engaged and provide them sufficient challenges. Don't keep the challenge very high. nor keep it very low, sufficient enough for them to do. So these are some of the strategies which work very well on gamification. What are the perceived advantages? We will ask somebody. Can you say something? Or what do you think would be the advantage of using game-based learning?
First of all, ma'am, interesting it will become.
Interesting, very nice. Okay.
Will continuously engage in attention of the person.
Okay, attention grabbing and continuous engagement. Okay.
Interesting and attentive.
Okay, interesting. From this group.
Learning.
Learning happens. Okay.
Fun, so that
Okay, fun learning. Right.
Can build their confidence.
Okay, build confidence. Very nice. Anything else?
and it will be more practical. It will be
Okay.
almost realistic as we are
Okay,
doing.
authenticity is increased. Very good.
Creative thinking.
Creative thinking. Good. Ramesh, you?
More of involvement, more personal involvement.
Okay. Okay, so it is more personalized learning.
All of the above.
Thank you, sir. So, this is what literature says, increased engagement. They work in teams. Sometimes if you give them team challenges, so they learn teamwork, collaboration. There is a real world application, as Madam said, authenticity is increased. Improved decision making, critical thinking skills. Okay, what needs to be done? They are much better at trying to save themselves or trying to save the world from the assassin, right? So if they are going to apply the same thing, they can save the babies also. You can use them for distance training, not necessarily that we have to be present in the classroom. So if you build in some of these elements in your LMS itself, your reward point systems and all, so you could actually do it through online or remote learning modes. The most important aspect is learning analytics. So you can actually, as an administrator or as a program director, you could look at how many of your students are engaged in this, how many of them are using it. And nowadays, the learning management systems gives us so much of grainy data. In the sense, it will tell me if I have uploaded a video, how many of my students watched the video, how many of them watched the video in full, and how many of them watched it halfway through. I can also find out how many of them watched it at normal speed and how many of them watched it at 2x speed, right? And if any of you use Cisco online platforms, during COVID, we used to have any number of webinars, right? So the Cisco paid account even tells you how many of your participants are in audio video off mode. They've just logged in for the sake of logging in and not there in that. So that kind of learning analytics is available for you to look at. If you really are keen at trying to understand the human behaviors which go behind all these things, you could actually look at these things and do. So if the students think that they are smart, they should rethink that we are smarter. So that is what it is. We can also look at swift feedback. Immediately they will know whether their answer is correct, whether that baby got saved or got killed or what happened to that. So that is what it is. So we can actually boost student enthusiasm. We can make their learning very interactive, especially in groups. We can give real-time feedback and use it for evaluation. We can enrich their educational journey and tailored learning pathway. So now everyone wants personalized learning pathways. So why should I get stuck with all 149 fellows who are not keeping pace with me? Or why is it going so very fast? Why can't we take some time? So both is very much possible with content. So what is the flip side? All cannot be very well, right? Games take a lot of time to develop, even if it is already available. Simple games, if you want to play, you need some time, you need some planning, you need to actually know how to debrief, you need to know what is that you are trying to actually achieve. Cost for doing it. Simple things. We recently did one origami swan making. So we had to go to Arvind Ashram and buy the origami paper. Each team we had to buy for 90 rupees. So 10 teams are there. You need to have 10 things. So it takes money. You also need certain amount of expertise. All of us cannot do all things very well all the time. The need for constant new. Oh, this is something which we found as a major problem during COVID. All of us went into online mode of teaching, right? And to engage the students, we used to use quizzes, polls, and some interactive activities during the class, middle, in the beginning of the class, end of the class, etc. So if we use for 4 times Mentimeter, no, 4 classes, one or 2 weeks, then at the end of it, they'll say, Mentimeter, we are bored, ma'am. Give us something else. Okay, let's do Kahoot for next few days. Then you will do for Kahoot for some time. Then they'll say Kahoot is boring. Then go to Slido. Then go to Socrative. How many things you will keep on going? But the urge for something new is always there. So they become, the shelf life of all these games become very short. So that is the problem with technology. No, Samsung keeps introducing one new phone every 3 months, 4 months. Apple becomes once in 6 months. So that becomes an issue. The need for constant new. There is also an issue of over gamifying. Problem is if you don't debrief or if you do not start with your objectives very well defined, then what happens is people only buy in into the drama elements in that. Okay, the engaging elements used to happen with our community medicine postings also. If you take them to village to learn about the cost of treatment or the resources availability and all that, they will only see it as a picnic. Okay, they'll take us there, give me more and give me some sundal and bring back. So it depends on whether your objectives were very well defined in the beginning. So that becomes an issue, over gamifying. Forcing everybody, some of them may not be very comfortable either because they are technologically challenged, or they may not be very comfortable in groups, or they may not really like doing these things. So forcing them into games, over focus on fun, I told you about, and neglecting assessment. That is the commonest problem which we find. We try to do a lot of activities, but we never try to assess either the immediate outcomes or this. There is a very nice model which we use in educational training program called as the Kirkpatrick's model. The Kirkpatrick tells us how to assess educational outcomes in a training activity. So the level 1, the lowest level is reaction. Did you like today's session?
Yes.
So no, it could have been better. Food could have been better. Okay, the ambience could have been better. So that is the level 1. Level 2 is assessing what has been the knowledge or the skill gained from the activity. Okay, to start with, we were at this level. Pre-test, your score was 3. Post-test, your score became 6. So you gained a certain amount of knowledge in that particular session. But that's very instant, right? At the end of the class, when we ask questions to our students, all of them will answer. Yes, this is the microbe, this is the drug, this is the therapy, this is the surgical procedure. But you ask the same question 1 day later, 1 week later, then we'll realize. The third one is behavioral change. Because of this training activity, did they change their behavior? Did they incorporate any element which they learned in the training program into their actual practice? That becomes much more difficult. And the last is going to be, what is the impact on the society or the community from which these people came, right? Because they attended this training program, did that assessment of the students change? Or did the teaching learning methodologies in the classroom change? So that becomes very difficult. Most of the times, we are trying to keep ourselves only at educational level 1 outcome. We only collect a feedback at the end of it and said everybody in the program liked this. 90% they gave very good answer. So that is where it is. Some of us do level 2, but level 3 follow up, it requires a lot more time. So that is the problem. So these are the perceived advantages, pros and cons of gamification. And to do this effectively, it just doesn't come because most of us are quite inhibited, right? We don't, it's okay for me to come and give a lecture, stand in one place. But if I were to act as a facilitator for a session, that involves constantly talking to people, motivating them, pushing somebody who is not participating, somebody is overly aggressive in a group, trying to ensure that they are controlled. So it takes a lot more facilitation skills for faculty to be involved in this particular process. So you need to train them first so that they could take this and then do the things. That's why programs like this are quite important because the faculty need to be trained. So these are some of the things which we have used games effectively. We have used them for ice breaking. For teamwork, how to teach teamwork. We do it in small groups. How to teach creativity, critical thinking. We have done this management, right? You can look at the problems in multiple perspectives. So we have used quizzes and games online or offline mode. So these are some of the things that we need to do, and each of it requires a lot of faculty development. You need to do what you are talking. Instead of just talking, you have to actually show that you could do this. So that is the most important point. So how do we gamify our classrooms? We can try apps like Kahoot, which is very simple. The students can take their avatars, so they can become zebras or horses or sheep and whatnot, right? Devil and all that. So you could actually do. Class Dojo is another app which is very effective. Class Dojo is very simple to use. You can actually use up to 50 students at a time for free. And if you buy paid registrations, you can use it for up to 500. Mentimeter, if you buy paid ones, you can use up to 2,000 people. You can come for your pro licenses. So you could use these apps. You can have frequent class competitions. So you can actually do this in your classroom at the beginning of the class, middle of the session, end of the class, but vary the routine. Don't keep every day in the beginning of the class or every day in the end of the class. So if you bring in some element of surprise and then have polls and quizzes or quiz at the beginning as your activity, it can work. You can actually put smart challenges, targets for your students, create learning levels of difficulty, which the students are encouraged to come. They have to do some work and then solve that particular puzzle. So escape rooms are a very, very, very nice way of doing. I'm sure there is an escape room in Pondicherry. Anyone has been? Escape room, yeah. Tell me about it.
There is one here, but I have been to one in Delhi.
Okay.
Basically, they have a team of 4 and they have a timer of around an hour. And they have this interconnected 4 rooms. Basically, they'll put you in a situation like a terrorist escape, like a victim escape. So then you will have to, 4 of you have to work in a team. There will be clues, some numbers, some lock, some keys hidden here and there. And you have to unlock that door to go to the next room. And finally, you have to escape in an hour.
Very nice. Thank you. Your name, doctor? Huh? Ojes. Thank you, Ojes, for coming up with this. So escape rooms are basically like that. You will be locked out. You have to find some clue, gain some points, and then you will get a key to unlock that room and keep to the next challenge. So if you do this 4 rooms or 6 rooms, then you can escape the entire situation you are in. So similar things can be done for students. We tried this with physiology. So what we did was we put challenges, respiratory physiology, cardiac physiology, right? Then metabolism. So we made challenges, rooms as each one as challenges. So in each room, they had to do certain activities. Either they had to solve some puzzle, right? Or they had to do some MCQs, or they had to perform a skill. And if they do these activities, they'll get some point. But if they do these activities within this period of time, they will get more points. So if they accumulate certain points, they can move to the next challenge. So by the time they finish these 4 challenges and they come into the main room, there will be some integrated physiology exercise on exercise physiology. So if they solve this, then they will get certain points. The team which solves it maximum clues in the shortest time would get this. So that way we were able to get many of the concepts into a gamified mode by the students. They could learn it very effectively. So the whole classroom we converted into an activity-based learn. Otherwise, what will happen is we will be conducting tests on exercise physiology. We'll be teaching only cardiovascular physiology, etc. So we made challenges which made the students think, which made them work in groups, which made them actually to solve that puzzle and make it engaged. So that is what we did. We actually, sometimes you can do online badges or awards. So instead of telling that you came first in the class, you could actually send one online award. So I can put it in their Instagram picture or Facebook. Today I got an academic award. I don't think they bother much about academic awards, but still we can try. You can also do cumulative scoreboards with weekly prizes. These are some of the strategies which all of us can use in our classrooms to make learning much more interesting and gamified. So what we saw earlier, right? How we can substitute. You can use actually online leaderboard rather than your display in the notice board who came first in the class test. You could actually give digital stickers, badges, etc. You can allow choice of assessments by, you can say that these are the 2 levels of assessment. It is up to you to take which one you want. And you can actually use social discovery leaderboards. You can modify the games using standard learning methods. Like what I said, when we wanted them to learn about critical thinking and teamwork. So we made them cross that. The US military has a game, which is called as crossing the river of fire. So you're supposed to cross from one end to other end of the room using some rafts. And if you step outside the raft, your leg will be amputated and all. So they'll have to really think smart ways in which they can move from one end to other, and the entire team can move. So that is something which you can do. You can redefine, you can make many of these simulation-based games. So that is what we need to do. And since we were involved in this, we were doing all these activities as standalone kind of activities. So for some training programs, we were doing some of the, games we tried in the classrooms, the escape rooms we tried as a project, the pathology we tried as a part of quality audit. We wanted to put everything together. So we found an opportunity during the electives postings. So where we did a 2 weeks posting on gamified simulation. The program worked in such a way. So we will try to introduce a concept through a game. For example, today's topic is teamwork for patient safety. So we will do a game based on teamwork. We'll have a debriefing. We'll talk a little bit about the role of teamwork in patient safety. And in the afternoon, we'll run a simulation scenario based on teamwork. So the next day, we will review what happened. And then we'll talk about something else, critical thinking skills for improved patient care. So like this, we did for 12 days continuously. Very interesting thing. So we started with reflections. So this was what the ice breaking we did. We asked them to become human billboards. So talk about yourself, what you're good at and what not and all that. And we wanted them to learn about the history of simulation. So we sent them in the sim lab with a treasure hunt. We asked them to go to identify a mannequin on which you can put a Riles tube. Identify a mannequin where you can catheterize. Identify a mannequin which shows heart sounds. So when we actually sent them on a treasure hunt to make them familiarize with all this. So we talked about the history of simulation and various types of mannequins, what all can be used. And then afternoon, we demonstrated what is a task trainer, what is a high fidelity simulator, etc., etc. So that's how the whole thing got structured. And we use the leaderboard concept. So every day they will get some stars. Whoever is doing well will get a star. At the end of it, we gave them some awards. So this was a very rewarding 2 weeks exercise for the entire SimLab team. So what we found or what literature found is that it enhances the student engagement. Performance feedback is very important. Instant performance feedback is one of the major advantages of gamification. Anyway, textbooks have become obsolete. They read only from their PDF in their phone, not even in a tablet. But anyway, that is one. And not necessarily you have to attend University of Berkeley or Georgetown University to learn, right? Many of them can now come to you through online modes. It reverses the infantilization of learning, what you're talking about, no? Making learning primitive or rote learning is stopped, improves the intrinsic learning process. Okay, it also helps to learn from their own mistakes and builds the teacher-student relationship. If you are actually giving them the feedback, if they are reflecting and you are giving them the feedback, it really is improved. So that in fact summarizes what gamification does. He's a very famous polo player, the ice hockey player. Okay, and in ice hockey, you have some grading points, something like how many of your shots you get converted into points or goals. And he has a whopping 97% conversion rate, which is unheard of in in this form of game or in any game. It's like having Don Bradman having 99% as 99 runs as average in test. No, very, very rarely only it happens. So when he was asked how it happens, like how did you get this number? How did you convert most of your shots into goals? And he said, I'm not actually, puck is the ball which they use for ice hockey. So I'm not going to go to where the puck had been, but I'm going to go to where it is going to go. So I can predict where it is going and I go there. That's why I'm able to convert most of my shots into something which is outcome. So we need to seize the day. We need to think about not where we have come from. That's very important for us to know. But we need to learn towards, or we need to move towards where education technology is taking us and where these advances are taking us. So we need to be in the forefront so that we would be in a position not to be left behind when people are there. Our kids are very, very smart. Our students are very, very smart. They run much, much faster than us. So we need to actually gain a little advantage by going initially a little further than us so that they will be able to catch up with us. So this is the Roman Empire motto, Carpe Diem, seize the day. I hope that we all seize the day and make learning fun. So this is the Golu we kept in our simulation lab. So all the mannequins were dressed up and they were put as dolls. And we invited the first year students to come and visit the Golu, and they could actually find out what the mannequins could do and things like that. So our job is not to provide information, but our job is to make learning fun. Thank you very much for your attention.